Some hospitals create the very drug dependency that they complain about. Yes, I said it. Let's stop behaving like this is only a home problem. Yes, it can be a home problem, but some hospitals are the ones who create drug dependency in some warriors. There are two dangerous extremes happening in our hospital. First is the criminalization of pain. A warrior can walk into the emergency room with crisis, come to the hospital to see a doctor, and instead of compassion, the warrior is getting suspicion. You were here recently. You're always asking for pentazocine. Is it that bad? Pain now becomes a courtroom. The patient now becomes the accused. What now happens next? The patient leaves, they go home and they go and self-inject. They find pharmacies that won't ask questions. And these pharmacies, people are selling controlled drugs as if it's chewing gum and biscuits. But healthcare workers know that when you make hospital care humiliating, you push your patients into self-management. Now let's talk about the other extreme. That's what I call the quiet factory line. In this case, you won't get a proper assessment. You won't get a stepwise analgesic plan. No attempt at structured pain control. Just opioid upon opioid, pentazocine. They'll be injecting you 4 hourly, 3 hourly, 2 hourly. Just be injecting you so that you just be calm. You won't come and complain about pain. You'll just be there sleeping. They increase the dose and at the end of the day, they discharge you. Sometimes it's not even because the patient is stable long time, but because they need the bed. But you seem calm, you can go home. That's not care, that's convenience. You cannot oversedate warriors for years and then act shocked when tolerance builds up. You cannot label patients as addicts after creating unmanaged opioid cycles. Either you deny the pain or you numb the pain without a plan. Both of them are dangerous. Health workers, I know you are overwhelmed, but you cannot deny pain and call it caution. You cannot over-medicate and call it care. Warriors deserve structured pain management, not suspicion, not lazy dosing. Have you ever been treated like a suspect instead of a patient? Have you ever been overdosed just so the hospital will stabilize and discharge you? If you live with sickle cell, what has been your experience with strong pain medications in the hospital? If you are a parent, what have you been witnessing? If you work in healthcare, what do you think we are getting wrong? Because we can't fix what we refuse to discuss. Please let me know your thoughts in the comment section. We need to talk about these things.